Over the course of the last 3 years, I've had 4 biopsies, 1 in each breast and 2 in my armpit. When my doctor first recommended a biopsy procedure, I remember envisioning it was going to be more like a surgery than a biopsy. And that vision that I had in my head caused me a lot of unnecessary stress because it wasn't at all like I had imagined. So today I'm going to walk you through step by step my very first breast biopsy procedure so that if you have an appointment coming up, I hope that it can take away some of the unknown and allow you to let go just a little bit of that stress, knowing what the procedure is going to be like. The preparation for my biopsy procedure was quite minimal. All I had to do was refrain from putting on any lotions, deodorants, antiperspirants, or powders in the area that was going to be tested. When I got to the hospital, I was asked to remove the top articles of clothing completely and put on the gown with the front open. For this reason, I would recommend wearing an outfit that has 2 separate pieces, top and bottom, so that you can easily take off the top and keep the bottoms on for added comfort. My biopsy was ultrasound guided, which means that the ultrasound imaging was used to help locate the lump in question prior to and during the biopsy. When we got into the ultrasound room, I was asked to lay down on the bed, remove one arm from the gown, and position myself so that it was easy for her to take the ultrasound. So for me, that was laying down on my back, and then on my side, I had to put my arm over my head, and the area being ultrasounded for me was right here. So she took a few images, and she then told me that she was going to go check with the radiologist who was going to be taking the biopsy, that they had all the imaging that they needed. A couple minutes later, the technician returned and informed me that they had all the images that they needed to proceed. I then saw her start to quickly move about the room and get the tools organized for the biopsy procedure, at which point I started staring at the ceiling, as I did not want to see the tools being used, as needles, things going into my body make me very uncomfortable. So as I laid there, the doctor came in and said hello and immediately started to inform me as to the steps that would happen next in the procedure, talked about the risks, and asked for my consent to continue with the procedure. I remember thinking that the risks were very minimal as compared to finding out what this possible hazardous mass in my body was. So I happily and nervously gave my consent to continue. Once he found the area, he let me know that he would be putting a pen mark on my skin, which would indicate his chosen point of entry to get to the lump. He also made a verbal note to the ultrasound technician of the angle at which he would enter the skin to get that sample. After that, he handed the ultrasound wand to the technician and grabbed a swab and told me that he was going to disinfect the area. I remember the disinfectant being a very notable and bright color, like pink or orange, but I can't remember exactly what it was. Next up was the freezing. And I don't know about you, but no matter what procedure I go to, whether it's at a dentist or during a biopsy, I always forget about the freezing portion as I'm focused so much on the biopsy itself. So once informed about this, I realized that the freezing was going to require a needle. And I don't handle needles that well, but I have come up with a few little tips or tricks that help me get through it. So the first thing I do is find something to clench. So in this case, with my arms like this, I clenched the pillow up above me and I clenched onto my gown below me just to have something to hold on to. The second thing that I find really helpful is to find something to fixate on, to read. So I instantly look above me and beside me, away from the point of entry, on the wall for something to read or something to look at. If there isn't anything there, I find something to be fascinated with. So look at the structural integrity of the wall or the roof. And the third thing that I find helpful is to take deep breaths and exhale quite forcefully as it's going in. Those three things together I find helpful for that piece. So the needle, the freezing needle, was what I think a bee sting might be like. It went in, it stung, and the sting resonated a little bit out from the needle for a few seconds, and then it disappeared. I was told that he put the freezing in a couple more spots, but after the initial sting, I didn't feel a thing. The doctor waited a few minutes for the freezing to fully sink in, then did a couple of tests to see if I could feel anything, and I couldn't. So the next step was to create a small incision where that pen mark was put on my skin through which the biopsy would be performed. So in my head, this incision would need to be about the size of my thumb. But in actual fact, I found out that it only needed to be large enough to fit a large needle through. So that was only a few millimeters, which is way better than I expected. And I couldn't actually feel a thing. So at this point, you may be thinking, why the needle? Why does it only have to be small enough to get a needle through? And I didn't get that either. I thought that the doctor was going to need to fully go in and cut the sample out. But actually, he was able to put in a large needle tool that, in my brain, has a claw on the end, and it just takes a small circular bite out of the breast tissue, holds onto it within the needle, and then the doctor removes it, which is way less invasive than what I had envisioned in my mind when I heard the word biopsy. I was told that the goal of this appointment was to get 6 good samples of the unidentified mass in my breast. So that was the next step. The doctor informed me that he would be taking this large needle tool, inserting it into the small slice that he just created in my skin, into my breast tissue, and watching with the ultrasound imaging where it was going in my breast. And then this tool would take a bite out of the mass, hold onto it, and pull it out, which I thought was very cool. So as he inserted this tool into my breast, it wasn't painful. I could feel pressure, but it wasn't pain. He lined it up and he told me that he was ready to take a sample. He informed me that I was going to hear a very loud clicking sound, but ideally I should not feel any pain. I told him I was ready. He counted down, 3, 2, 1, click. Nothing. I was very thankful I did not feel a thing. He pulled it out. The technician was waiting there. He did something with the sample. She gathered it and he went in for another. Once again, as he inserted the needle into the incision in my breast, I could feel pressure, but no pain. This happened 3 more times for a total of 5 times. Honestly, even though I knew that it wasn't painful, every single time I kind of anticipated having some pain. So by this time, my body was starting to shake. I was sweating, even though I was still clenching my pillow and I was clenching my gown. I was staring at the ceiling and I was doing those deep breaths, but it was starting to wear on me a little bit. He asked me if I was okay to do another to get to that 6-sample goal. And of course I said yes. We had gotten this far. I do not want to stop short of the goal of 6 good samples. He went in one last time, lined it up, click, immediately knew for whatever reason that that was not a good sample. He asked me if I was okay to go one more time. Once again, I said yes. So we went in one last time, click, good sample retrieved. I'm very thankful to have that over, but also very thankful to reach the goal of getting all of the samples from the different areas of the mass to make sure to get all the testing that was needed. I was very surprised to find out that a stitch or two was not necessary for the incision that was made, because at this point I was still thinking that it was a larger incision, but all that was needed for it to heal well was 2 steri strips kind of holding the incision together, and then over that they placed a larger gauze pad with tape all around the outside to keep the area protected. After that was in place, they removed the remaining sterilant that was on my body, that bright color that I was talking about, so that it wouldn't get all over the clothing. And then I was able to sit up as we went over home care instructions. Although the incision that they made was quite small, I was told that because they did take a large needle into the core of my breast, that there was a high risk for infection. So for that reason, I was recommended to not shower for at least 24 hours and to leave all of the bandages on for that time. I was also recommended to refrain from lifting anything over 5 pounds, to not do any strenuous activity, and to not submerge myself in a body of water like a bath or a lake until after the 3-day mark. The other thing I was recommended to do was to apply an ice pack for 10 to 15 minutes on the area, on and off, for the first 24 to 48 hours. To be honest with you, my first biopsy, I was not good at this. And after the freezing wore off, it was quite sore. In subsequent biopsies, I did apply this recommendation, as well as wearing a tight-fitting sports bra to keep everything up, and it did help to decrease the pain and the swelling in the area in the days to come. So I would recommend following that. In my specific case, I was told I would receive the biopsy results in about 5 to 7 business days. All in all, this appointment was way less invasive than I envisioned. I can't say for sure if your biopsy experience is going to be the exact same as mine, but as I've mentioned, I have had 4 biopsies now at 2 different locations, and all 4 have followed this procedure. So I hope in some way this helps alleviate a little bit of the stress and worry that you may be experiencing prior to your biopsy appointment. If you are new to this channel, I just want to say thank you for being here with me. The primary goal and purpose of this channel is to help women through their breast cancer experience. So I hope if you're just watching this video, if you're going in for a biopsy, I hope that you never have to look up this page again. But in the off chance that you do receive a diagnosis, in that case, I do hope that you remember me, you remember this video, and remember that my whole purpose is here to support women through their breast cancer experience, to help take away a little bit of the unknown so that you can focus on your fight. If you found this video helpful, please give it a like. If you would like to join along for more breast cancer inspired videos, or you just want to remember this channel, hit subscribe. I wish you all the best in your health. Take care, and we'll see you next time.